Would you please tell us what is the renal denervation?
Well, renal denervation is a technique where we go in with a catheter into the renal arteries. In the wall of the renal arteries there are nerves going to the brain. These nerves stimulate the central sympathetic drive and they cause hypertension. So with this technique of renal denervation, we are interrupting these nerves and that lowers blood pressure.
Can you suppose how many hypertensive patients will be the potential candidates of renal denervation?
Well, currently we use this only for patients who have resistant hypertension, severe resistant hypertension, which means they are on at least 3 different antihypertensive drugs and still have blood pressure above 160. So that means currently it's a small percentage, let's say about 10-20% of all patients with hypertension. But we already have some preliminary data that it would also effective in patients who have not that severe hypertension. So if you want to have a number for how many patients this may be a procedure in the future, you told me earlier that there are 50 million people living in Korea. So I would guess that about 1/3 of them have hypertension. So if this turns out to be a treatment for all patients with hypertension, then you will have about 10-15 million people in Korea who could benefit from this treatment strategy.
I know this procedure is very safe, but are there any complications during the procedure?
Well, actually, the only complications we have seen are those complications associated with every kind of catheter intervention, like groin hematoma, or there had been 1 or 2 cases actually worldwide now where due to the guiding catheter, little dissection was caused, which could be treated thereafter with a stent. So it's amazingly a procedure which has almost no serious complications at all.
How long it takes to do a procedure usually?
Well, we currently use the only device which is currently approved is the Simplicity catheter system from Medtronic. With that device, we have to go into the renal artery and look for different spots where we do the ablation. And because during the procedure we don't have a feedback about the result, this will come out only weeks afterwards. So we do as many ablations as we can. And that means for each renal artery about 6 to 8 ablations, and each ablation lasts 2 minutes. So when you add all this, it takes about 40 minutes, up to an hour to do the procedure.
Many of renal failure patients has hypertension. However, renal denervation is currently contraindicated for renal failure patients. Is there a possibility to expand the indication of renal denervation to those of patients?
Yeah, absolutely. I mean, only in the randomized trial, patients with renal insufficiency had been excluded for safety reasons. But that was not because we have seen adverse events in these patients. In the initial trial, in the Simplicity 1 trial, patients with renal failure had not been excluded and they can be treated and they benefit from the procedure. So I think there's actually no reason to exclude patients with renal failure, and we are treating these patients as well and we have good results.
Let's move on to the other subject, LAA closure, the device. New antithrombotic drugs are recently approved for prevention of stroke in AFib patients. Do you think what will be the future role of a LAA closure device?
Well, actually, this will not change the future role of these devices at all. And that is because with all anticoagulants, you always have a bleeding risk. And this bleeding risk continue to be there. So the longer the patient is taking the drug, the more bleeding risk he has. Actually, when he becomes older and older, at some point, he has to stop anticoagulation therapy anyway. So although the new anticoagulants are a little bit better than the old ones, it will not change the concept. And the concept is to replace a lifelong medical therapy by just one single procedure which solves the problem. So I think it will not change the role though.
Okay, thank you for your answer today.
You're welcome. Thank you.